Been working alongside the Help Hub for pretty much all of the 10 years actually. I used to work as an officer in South Norfolk when I was in a lower rank, when the Help Hub was starting out, and from day one you could see the real benefit that it would bring.
The origins of the Help Hub were as a consequence of what was required and spelt out in the Children Act 2004, which was really about prevention and early help.
So we wanted to bring a partnership together to ensure that when issues first arise, that we can deal with them quickly before they escalate into statutory services.
So part of what we tried to achieve with the Help Hub was trying to stop that kind of onward referral, endlessly passing the buck from one organisation to another. So bringing everybody together, sharing information, and I think we began to share information in a way that at that point really wasn't being done before.
Health wasn't involved directly in the very beginning, but very quickly we saw the potential. It's about bringing all of us together to work with our citizens, our patients, our service users, from wherever they might come in the system, to wrap around them and give them the care that they need so they can tell their story once.
Good policing is about prevention and solving problems, and the Partnership Hub enables us to do that so that we can provide the right intervention to deal with the problem that is facing us.
One of the most important things that paved the way for how the Hub works today is having a really good understanding from a ground, community-based level of what was happening in your patch and what's happening for families in the place where you worked, understanding the place. And bringing everybody together to have a shared vision and a shared responsibility for the people that live within that community.
When something isn't right, many of us go to our GP, and we see that 50% of the referrals into the Help Hub come from GPs. But sometimes it isn't necessarily an underlying health issue that's causing the problem. It might be loneliness and isolation. It might be worries about debt that are causing anxiety and mental health issues, and people being unable to sleep as an example. So just giving somebody a pill isn't going to solve that problem, but the Help Hub can.
We know that some of the drivers of crime and antisocial behaviour are things like employment, are things such as boredom, things such as isolation. The great thing about the Hub is they've almost got their directory that can point you into the right direction.
We know that everybody holds a bit of a picture about children and families, and the only way we're going to really helpfully and in a meaningful way support children and families is if we put parts of that picture together.
Principles are still the same as they were when we first started, which is that a family could come and just tell their story once rather than have to navigate a complex public sector system. Now the Hub is just more advanced than what we first started, but still working on those basic principles.
This ethos of people working together across different agencies is absolutely vital for Norfolk and Waveney. And we're doing it better here, I think, than anywhere else.
By being alongside each other, taking the advantage of not just of what we know, but also our shared skills, we become richer in our understanding. It can only be the way that we would want to work, not just now, but into the future.
10 years has gone really quickly, but I'm sure there'll be many more years ahead of us, and the constabulary will forever want to be part of the Hub and be a committed member to it. And I just hope it goes on from strength to strength.